So I declare that I might doing in the so different field uh, compared to others. So my topic might be some kind of situation analysis and point of the gap that you can go on in the health sector. So I am Peerasit Sitthirat. I am the general practitioner. I'm the doctor in the Ramathibodi hospital, but my main job is not the treating the patient, but I'm the researcher. Uh, I do the research that called health policy and system research. So for research in health, we categorize into like many category. You might be familiar to like biomedical research or clinical research, but in in other large group is a health policy research that we are doing the research for the by finding the evidence to support the policy decision making. So this is our team in Ramathibodi that includes like physician, dentist, pharmacist, or anthropology and students. So in this field of research, we do like delivery side, improvement science, operation research or implementation research. So firstly, I want to introduce you the concept in health system before we go to the situation in the urban area or just in Bangkok. In our discipline, we want to establish the thing that called universal health coverage or UHC, which means that our people can access to the full range of quality of health service that they need when and where they need them without financial hardship. So you can see from the cube in the right side that we want to cover all of people in all services that they need and all the costs that they have to pay in full range of the service. Since the health promotion and prevention, treatment, rehabilitation, or palliative care, or like in of life care. So this is the full spectrum that health service include that we want to include the coverage to this service. So in Thailand, so it's a luck of Thailand that we all have like high range, high full coverage of people. About more than 99% of Thai people were financially protected. That we all have the coverage that we can go to hospital and get the free service. And compared to the country in the South and Southeast Asia region, that we can see that Thailand is a high, it's a high of coverage index and low catastrophic of pocket health spending. It mean like Thai people have not to pay for getting the health services, and we cover of all of people. This is the literature, and I think in this room, if you are Thai people, you might think that it's real or it's not real. I have to pay for my service, right? Okay, I will tell you later. And more than the coverage we want the effective coverage. It is not just about that people are covered by the insurance from the governance, but people have to get the quality service also. If you can see from the right picture, you can see that if you are a child, you have to get vaccine. It's just the coverage, but vaccine have to work effectively that you not get infected. This is called effective coverage. Or if you are pregnant woman, you go to hospital and receive the antenatal care. It's just the good coverage. But the high quality of antenatal care, you have to give birth of child that have the normal birth and healthy infants. So it's called effective coverage. In Thailand, we have just achieved the good coverage that that most of people can get the vaccine, can go to hospital whenever they want, but the quality is the gap. As you know that if people the diabetes in Thailand, only like 20 or 30% of people can control their sugar level in their blood. So we begin for the challenge. Challenge in the urban population. The first challenge is the dynamic of the population. That we know that the population in the urban areas such as Bangkok have categorized to be three groups. First one is the registered residents. Second is non-registered residents. It's maybe internal migration from other province to live in Bangkok. And last one is commuter population that come to Bangkok, just work in the daily and go back their home. If you can see the population in the Bangkok, about 5 million are registered, but they have 2 more million that non-registered and have a bit for commuter. That if you know about the insurance governance in Thai, you see that non-registered residents have the problem about the insurance that they get to hospital. And you can see that the Bangkok is the most lowest net migration, that people don't want to move out from the Bangkok, and other provinces want to move into Bangkok also. So it's the challenge one is a dynamic of the urban population, because of in terms of health services, we just don't know exactly how many people live in Bangkok, because in the database we just know about the registered one, but the non-registered we just don't know that how many people in this group. So to design the services to serve this group of people is quite difficult, because we don't know the volume, right? And the second challenge, it might be that a lot of technical term. If anyone that don't understand my word, you can leave it in the comments. For the health service system, we know that in the Bangkok is full of resorts than other country. You can see that the physician, about like 25% in Thailand, is working in Bangkok, compared to other province. And the proportion, you can see that this the ratio to population of non-Bangkok is about like 5 doctors per 10,000 population, but in Bangkok the number is so high, it's about like 3 times away from non-Bangkok. It means like in the Bangkok, the resources are like accumulate in this province. And for the health system, in Thai health system, you can see this is a provincial health system, that you can see the lines of command from the ministry to the hospital in the province. But you can see from the Bangkok, the health system, health service is so fragmented. It means like any hospital or any private clinic have their boss. Like you go to hospital in Thailand, in Bangkok, and you will see that in this hospital, like Rajaviti Hospital and Ramathibodi Hospital, is not the same boss. We have also other boss. So service system in Bangkok is so fragmented that mean to align the system is so difficult, because the way they work are different. And you see that about 75% of hospital in Bangkok is private. It means like for the like poor population cannot access to this facility in Bangkok. And what occur in the urban area, you can see this some indicator from the urban health, and you can see about the pregnant women that receive the antenatal care. We wish that each each pregnant woman can receive their first ANC before 12 weeks. But you can see that if we order the population density in district level, you can see that the first one is the lowest density. It means like the rural one. You can see that the percentage is very low compared to the highest one. It means like if uh, when the more density of the population, the pregnant women have more difficult to receive the antenatal care before the time that defined. And you can see from the right side that we compare the province with the urban core and non-urban core. You can see that the urban core have the disparity between the highest density and lowest density one more than the non-urban core provinces. It means like when the urban is more advanced, the health accessibility is lower. And the challenge is the third challenge is the determinant of health in urban area that might differ from other area. First one is the environmental factor that we already know it, that the air quality in the Bangkok we know around the average of PM 2.5 is about 20 is more than like 4 times that the WHO suggests to be. The water pollution and waste management, we know that Bangkok generate about like 10,000 tons of waste per day, but less than half that was recycled or reused, just about like 4,000 tons per day. And the climate related health risks that we know that in Bangkok we also we have only like small space for green space that can like absorb the heat stress that the WHO recommend to be 9 in Bangkok. In we have already like 1.5 meter square. And you can see that in the urban area, you can see that the day that PM 2.5 is lower than what it should be is only like in the only 3 months per year that we got. And another aspect is the socioeconomic condition. In urban area, we cannot deny that we also have the advancements of like we have the rich people in this area, but we also have the very poor people in this area too. We just know about the disparity of the income, and the poverty in Bangkok is also like high. We just estimate about like more than 500,000 people live in Bangkok slum, which is like about 30% of city population. It means like this population is quite the major group of population that we need to do something about, like technology or something to target this population. And for the employment, we know about like 28% of workers in Bangkok have informal job like motorbike or taxi driver or street vendor or home-based piece work that we cannot get them to the system on the work market. And this is the location of slum location in Bangkok. You can see that it's condensed in the like center of the Bangkok. So for the health, this one is a summary one that there are many determinants of health that we have to tackle. If you want to like develop some technology, I think there be might some component to tackle or to for improve the health for the population. And the last one, the fourth challenge is a data missing. In the first, A just introduced me as I am the researcher that doing with the large data set to generate the evidence to support the policy. But in Bangkok, I cannot because in Bangkok we from the second challenge you can see that each hospital have their boss, so they don't no need to send the data to the central platform in the central government. You can see that in Bangkok is the 13. You can see this gray one is mean in this indicator such as like maternal death rate or development of the newborn or emergency care accessibility. We don't have the data of this in Bangkok at all. So if you want to do some technology about the data in Bangkok, is quite the big gap. Also, I have uh, I have included some technology that we can use in Bangkok right now. Just for introduce you that this is a health technology that we talk each day. First one is the Bảo Tang application. So I think you know. Most of you know it already, but you can see the feature that the Bảo Tang have the feature called health wallet that include the benefit package, just like receive the contraceptive or can screen for the diabetes. So you can go to this application and click on the benefit package to see that which facility that you can go and get this benefit package for free. And other one is a Rakim application. Is a new one that use the AI to scan for disease that the screen for the carry of the disease that people no need to go to dentist. And support them with they find the carry they can go where, something like that. This one is the example for health technology one. For last slide of me, I just want to tell you that it is quite the goal that health system researcher as me want to do is to build a system that more justice, more equity, and more justice to the population. The urban area, you might think that is the area that the technology is so advancing, and we got a lot of like research from this nation, but actually the urban area. So we call like Bangkok, they have the huge gap of the people that the richest one is here, but the poorest one might be here too. The gap between this population is also huge, but the policy in policy today is not address this gap. We just also want to like advance for like technology or something like that. So I just want to like tell you that the thing that could be set at the target is to build more equity and justice for the population. The equity that means the people you can see that the people that want less they use less, but the people that need more they have to support more. But the justice is the like realign the system that cause the disparity of this system to be like more straight, and like everyone can get what they need. Okay, I think it's the end of my presentation.